few upcoming sessions that I just wanted to let people know about. So May 20th, we have Hunter Healthcare doing some interview skills sessions and career development sessions. Then we have leadership development for data analysts on May 26th and making analytics great and used with GraphNet on June 9th. So if either of those are of interest to you, you can sign up for those on the website through Eventbrite and be able to attend those sessions. Keep an eye on the website because any upcoming ones after that will be advertised there as well. So that is it for me, and I will hand over to Sarah, who will be taking the lead on today's session. So Sarah, thank you for joining us today.
Thank you very much. And just to flag, this is, a really open session. I have lots of opportunity during the presentation for you guys to pitch in. But if anything comes up during, if anything's unclear, please feel free to pop a hand up or pop it in the chat, and that'd be great. Lovely to see some familiar faces today. Thanks so much for having me. My name's Sarah. I'm a Senior Evaluation and Insights Manager at UCL Partners, working on Kate Chima's team, who was originally listed for the Lunch and Learn, so hopefully I'm a good substitute for it. In UCL Partners, we evaluate healthcare innovation in North London and beyond. So when we introduce something new to the NHS, did it work? And to do so, we usually use mixed methods. So I'm delighted to talk to you about it today. You'll see a lot of mixing references in this. I knew AphA would be welcoming of these kind of references. And today is really building on the wonderful talk last month by Tash Wilcox of TPX Impact, where she took us through the benefits of mixed methods and lots of detail on qualitative techniques you can use to amplify your quantitative work. Today, I'm going to do a brief overview of what is mixed methods, why specifically is it useful in healthcare, and particularly in our line of work, some recent and not so recent examples of it in practice, and a space for us to talk about why we don't use it so often and what we could do about that. Throughout, like I said, there'll be a few points for us to chat and reflect on what we're working on right now, whether mixed methods could support that, and how we can overcome those barriers that people often have in implementing it. So I won't go into a huge amount of detail on the kind of difference between qual and quant, because Tash took us through it really well last time. But to remind us, most of us specialize in quantitative work based in numbers, based in statistics, looking at large sample sizes to confirm or oppose hypotheses we make about data. Qualitative research tends to be more text-based research, the more talking, interviews, surveys, focus groups, the why, where we theme data as opposed to statistically analyze, often representing relatively small sample sizes. Although I'm keen to point out, these are generalizations, and you can have quantitative research using small numbers and qualitative research using huge sample sizes. In terms of a definition, in 2007, mixed methods research was defined as a type of research where elements of qualitative and quantitative approaches are combined to improve understanding and cooperation. And what's important is this isn't just in the final stage where we look at the data. This mixing can occur in all levels, so in the development of methods, in data collection, in analysis, and in final interpretation. So why specifically is it helpful in healthcare? Healthcare is, in practice, inherently complex and multifaceted. We can look at the numbers that we tend to report as the kind of tip of the iceberg, but they don't give you the whole story. And there's so many more things to understand and ways to explore issues under the surface using qualitative methods. So, for example, when we think about the COVID vaccine rollout in 2020, we had a situation where it was clear in some areas of Northeast London that some communities were not being vaccinated at the same rate as others. And that was the kind of tip of the iceberg. But it required really deep qualitative work by teams such as ours to go into communities, doing observations, speaking to people, healthcare staff, community leaders to understand what were the drivers of that, and ultimately to come up with solutions to encourage more people to take up the vaccine, or at least make the best informed choice they could about it. And as Tash said in the last Lunch and Learn, that kind of combination of quantitative and qualitative, can be a really sweet spot for having solid quantitative analysis, detailing it with the kind of wider qualitative picture, and therefore improving your kind of, just data-driven analysis further, and so on. And it wouldn't be a talk with analysts without this photo. So can anybody tell me what this is and where this is? And you can pop it in the chat. Thanks, Laura. Yeah, I like the description of it. It's just the cholera pump. I hope now it doesn't have so much cholera in it. But you're right, it's the Broad Street pump. And what stands out to us about this pump is that it has no handle. Us data nerds love the Jon Snow story. So this is all about Jon Snow's 1850s investigation into a cholera outbreak in London Soho. And this is the kind of origin of data visualization and a lot of what we refer back to in terms of mixed methods. So you can see on the left, he plotted on the kind of map of the Soho area in London, each death from cholera as a black bar. So you can see each street looking a little bit like a bar chart, and found that they clustered around this area of Soho and this one street which had a water pump called Broad Street. But what's interesting when we always refer back to this map is that this wasn't enough to prove that the pump was the source of the outbreak, because it wasn't yet proven that cholera was waterborne. So he also did interviews with local residents to understand which people did and didn't use the pump, and why there were some communities that were effectively spared from this epidemic. So, for example, workers in a local brewery at Broad Street didn't drink the pump water. They drank their beer rations instead. So there were no deaths in that community. And then he was able to demonstrate that the exceptions to the rule, using those qualitative interview methods as well as the quantitative methods of mapping. And this is mixed methods in action. So he used the two different methods. He triangulated the information, showing where people were dying with the map and explaining exceptions to the rules with interviews, and then ultimately succeeding in having that pump handle removed. And I feel real imposter syndrome explaining our work after that. Not trying to compare ourselves to Jon Snow, but we do pretty interesting work as well. So at UCL Partners, we're a health innovation network. We're a partnership organisation between the NHS, industry and academia, aiming to improve healthcare through innovation by supporting innovators through development, piloting, deploying and evaluating their intervention in the NHS. And when I say intervention, that can mean lots of different things. A new treatment, a new app to provide patients for self-management, for example, new ways of working, new pathways. We support all different kinds. And I work in a really interesting team with people who specialize in both kind of qualitative work, quantitative work, and everywhere in between. And we try to evaluate these new interventions to say, okay, how well did it work and what can be improved? From the clinical impact, the acceptability of the intervention from both patients, staff, and the wider system. What could potentially be the economic benefit of this intervention, and then how's it impacting the wider system as well. So doing this requires us to look at the intervention from lots of different angles. And mixed methods research really lends itself well to our work, because the intervention itself and how it's implemented is complex. We introduce something new. Its success is often driven by the context it's introduced in, so we need to consider that. We're often being asked to evaluate something while it's being introduced, so we have to be flexible and creative in how we look at it. We may be looking at data from pilots, so from relatively small numbers of people. And as these innovations are new to the system, they may have a very limited evidence base. So we may not know much about it yet in a real world setting. And as such, there's no gold standard way of looking at it. And ultimately, the results of our evaluations are being used to make real-world decisions. So they should be made with information which represents how this intervention is working in the real world. So mixed methods supports us to do that. So I've talked a little bit about mixed methods and how helpful it is in healthcare. I'd love for you to take a second and consider if there's a kind of question, a topic, a work area which mixed methods could help answer. And it'd be great for you to take a second, reflect on that. Please do pop any ideas you have in the chat, or pop your hand up if you want to mention it. Thanks so much, Victoria. Really interesting to hear more about that kind of patient safety incident data and understanding more about falls. So for all of these examples, please do keep them in mind, because we're going to revisit them later as well, and hopefully either on your own or in this group workshop. Sorry, I muted myself. Thanks so much for sharing, and we will go back and revisit those examples later as well. So I've shared an old example. Here is a current one from our work. So we were asked to evaluate an app which was being offered in our region to children and young people with asthma, because there's evidence that if you can support people well enough to self-manage their asthma through information, symptom tracking, and escalation where required, this can have a huge impact on both their kind of clinical scoring and the number of severe asthma attacks that they may experience, which could in turn reduce pressure on primary care, on acute services, and help them manage their condition well into their adult lives. So if you were to look at this from a purely clinical lens, like in a randomized control trial, you would look at the clinical data alone and say, okay, for those who had access to the app compared to those who didn't, did it impact on their asthma control scores? In this case, it's not a randomized control trial. So all eligible patients were offered the app, but not all of them took it up. And we know there's likely to be a relationship between engagement of the app and outcomes. So we need to consider who used the app and for how long. So we need to consider the kind of operational data to tell us that. And when we looked at the operational data, we found that some people use the app more than others, but some people also use certain sections of the app more than others. So why is that? We then designed an in-app survey, so people could tell us more about if they like the app, what sections they use, how they find it helpful. But ultimately, we want to get a large volume of people to fill this out. So you need to make it short and snappy so we can hear from as many users as possible. But we also want the opportunity to delve deeper into why they use certain sections more, or what could help more. So through the survey, we also invited them to take part in interviews to talk in more depth about why they use certain sections more than others and what impact the app has on using their condition. So for example, some patients may come back and say, oh, I only tend to look at the information section, in a crisis. This gives you more information about how they use the app. It helps you understand what you're seeing in the operational data. And then it also helps to interpret what you're seeing in the clinical data as well. We use this structure at UCL Partners using quantitative and qualitative data to explore if this specific app from Tiny Medical Apps supported asthma management, how it was supporting management, and what could be done to get the best possible outcome from it. And we did this in a few rounds. So we started looking at the kind of existing clinical baseline data, exploring operational data at the same time to see how we could explain their use. We were using surveys and interviews to understand acceptability of the app, but also to inform our kind of next round of analysis once the data started flowing through to show impact from the app, and highlight if we had any gaps as well following that clinical and operational analysis, if we had any gaps in the original survey that we might want to address. So that kind of cycle of analysis and improving our methods and our understanding continued. In terms of how you actually mix methods in practice, when you collect data, when you mix methods, there are lots of different options available, and we tend to use all of these in different situations. So sometimes we're asked to develop a measurement framework for an early phase innovation, one where the innovators are kind of aware of the value that their innovation has, but need help developing it into a framework so they can assess against it in pilot programs, for example. In this case, we may do interviews with stakeholders first as a kind of qualitative exploratory approach, to see what's already in place and what stakeholders might be looking for in terms of results from a pilot program, such as through development of a logic model. We might dig into the research and the existing data using a kind of quantitative approach to understand what tends to be collected in these situations and if there's a gold standard for measurement, and then pull that information together into a framework. And then that would be the kind of sequential exploratory approach. Sequential explanatory may be done in a situation where data has already been collected on a certain innovation, but we need to add an additional layer of qualitative context as the original results might not make sense on first glance. So, for example, in the vaccination rollout example. Concurrent or parallel approaches are quite common for us, where qualitative and quantitative analysis is ongoing at the same time, particularly if we have limited time to perform this evaluation. You'd like to understand what's occurring in real time so we can feed this back and support decision making to improve an innovation or a product as it's being rolled out. And as there can be kind of complexity in our kind of work, quite often we have to do this work in parallel if we have a short period of time in which we're doing the evaluation. So we may have delays in terms of developing data sharing agreements, getting ethical approval for our work, deploying surveys in a place they've never been deployed before. So this flexibility also works really well for us as evaluators using a kind of parallel method. And finally, for multi-phase programs, you do this in a planned sequence. So you may have periods of only qualitative, only quantitative work. And this is often common for kind of longer multi-year programs where at the end a very defined go, no-go decision is due to be made on introducing this innovation. So in the case of the asthma evaluation, it's a bit of a mix between that parallel and multi-phase, in that we had set series of quant and qual phases, but we also kind of gathered insights regularly and shared them back in a final report at the end to the funders. And in terms of how you use these mixed methods together, you may hear these phrases being used when talking about how we integrate information from evaluations. So you can triangulate the information, so using different methods to converge and validate results to reduce bias. You can use mixed methods in your development of your research, so using the results from one technique to inform the others, like I was saying earlier, in using the kind of survey data to better improve your quantitative work. You could be trying to complement your work, so using one method to elaborate or clarify another. Or you could be trying to expand your work, so using other methods to extend the breadth or the range of inquiry. And in the asthma example, we took elements of all of these. So we used operational analysis to inform our survey data, which was used to inform interview questions in that kind of development approach. We also triangulated the operational and survey data to tell us more about how certain parts of the app were used in practice. And then we kind of complemented and expanded our survey findings with interviews. As part of the feedback that you provided when registering for this Lunch and Learn, I heard that some of the attendees wanted to learn more about the kind of tools and techniques you use to do mixed methods. So you may have heard about In Vivo and something called Atlas. They are programs which allow you to save all of your different types of data and analysis from qualitative and quantitative work in one place and analyze it all together, which can sometimes be tricky when you have so many different formats. So it enables coding of different data types into a single framework. And you can compare all of these different data sources side by side. And in both of these tools, there are some fun tools for kind of cross-tabulating and mapping findings. However, I'm kind of keen to say they're license-based. There is an additional fee associated with these. However, with a little bit more kind of planning and perhaps developing a few templates personalized to your project, the same can be achieved with the Microsoft Office suite. So we use Microsoft Forms regularly for collecting survey data. We analyze some survey and interview transcripts in Excel. We do a lot of sense making of different types of data through creating mind maps, like in Miro, which is free online. And then ultimately as well, displaying a lot of that data through Power BI. And I'm keen to say as well that not only do you not have to use the fancy paid for tools, it's not the tool itself which allows you to mix methods effectively. It's very much the process by which you do your research. So, for example, when working on a mixed methods project, having the right team around you with those qualitative and quantitative skills is really helpful. Or if you're working on your own, at least having a few trusted people you can bounce ideas off of. A key point early on in our projects is developing a logic model where we can say what we expect the impacts of a program would be and develop that with stakeholders. We would say how we would actually get to those impacts and how we can measure our progress against it. And this allows you to very clearly identify where you could use both qualitative and quantitative methods in your work. In that, it's also really helpful to get your quant experts in the room when designing your methods. So when designing a survey, for example, you would probably already have an idea of what you would want to look at, but there will be elements which will have come up in the quantitative analysis that analysts will be curious to know more about, and then you can start to fill the gaps in your awareness through that. As data is being collected and analysed, you should also come together regularly to ask, this is what we're finding, what do you think? You start to kind of build those nuggets of insight. And with that, you may find further gaps or areas to explore. So you can further adapt your methods if you'll be doing another round of data analysis or interviews, for example. And then finally, when coming to the final report or final analysis, coming together as qualitative and quantitative teams to identify where your findings agree, where they disagree, and how that can be explained, as well as where are the gaps and what you might do differently next time. And again, if you're doing it on your own, doing that with trusted colleagues that you can bounce ideas off. So really, it's not about the specific tools, so I wouldn't put you off if you don't have access to those paid for tools. It's very much about defining a method and process for how you're going to look at data together. So thinking about your kind of general overall work and the examples you might have shared earlier, what do you think gets in the way of using mixed methods in your work? Feel free to pop up your hand or write it in the chat. Samantha, go ahead.
Hi, it's not what kind of sort of gets in the way, but it's the asks from higher up. It's like we want to give sort of like qualitative and quantitative overview of an evaluation on say our certain projects, but they might be focused just specifically on the quantitative side of things or the financial, and it's getting that balance as well. So although we might want to give them the kind of a fuller picture, they might be resistant to wanting that, which makes it difficult for us.
Yeah, absolutely. Thank you for sharing that. And I've got a few tips at the end, but is there anything that you found previously that you think has helped you overcome that?
We're still working through it. So we've had conversations actually this morning about trying to get in our meetings what is landing properly, because the goalposts get changed quite a lot. So it's how we manage that ask and give them a balanced view, that we can give them the qualitative and quantitative side of the story, like we use the story of change to feedback. And like sometimes they feel we give too much information on the written side. So yeah, we're still working through it.
Thanks, that's really interesting and echoes, I think, what I'll chat about as well in terms of asking for feedback on what you're sharing and making sure it lands correctly, but also on repeated exposure, I suppose, to that qualitative work, which it sounds like you're doing, is I think quite often it would be brand new to a lot of teams who've only ever received quantitative reporting before. But over time, I wouldn't want to say you wear them down, but you contribute more and more and demonstrate the value of including qualitative methods. So that's really interesting. Thank you. And thank you so much, Donna, as well, for sharing in the chat the kind of lack of engagement. And that's something that I'd considered as well. So thinking about what gets in the way of doing mixed methods, what we found can sometimes be an issue is an inherent misunderstanding of qualitative evidence, which is sometimes due to the fact that it's not presented often in these settings, and misunderstanding that the qualitative evidence is weaker than quantitative. However, we know it's not just the value of qualitative and quantitative is not that in itself. It's how it's implemented, its sample sizes, are you using these tools correctly? And I think like Samantha's doing, repeated exposure to this type of good work can reduce the risk of that as well. And as you've seen in the process that I've recommended, mixing methods takes time. It's more resource intensive than working in isolation. And one of the biggest pitfalls in mixing methods badly is mixing them superficially. So having, say, just a bit of qualitative work, a bit of quantitative work, and neither the two shall meet. And when you're limited in time and resources to do this, doing it under pressure really limits your ability to have those interactions that drives a lot of the really useful insights. But ultimately, I think there is a benefit in mixing methods when required, that you can demonstrate, because if you develop the best types of analysis to answer your questions and you answer the right questions at the right time, which mixing methods can often help you do, you're making it less likely that you're going to have to repeat those analysis in future. Like Sam was saying, a lot of the reporting requirements you might be asked to work within are numbers based, and it can be difficult to justify the application of qualitative methods. There can be limitations if you don't do a lot of qualitative methods in your work in terms of those skills and awareness of staff, but of course you guys are here, so we're developing that as we go. There are particular ethical and practical considerations of doing qualitative work in healthcare, like in all research, but we have situations in healthcare where there are particularly sensitive or protected topics that we might be asking questions on or gathering data on. So this is where a lot of IG considerations need to be taken into account. There may also be situations, if you're trying to do surveys or interviews, where people may feel pressured to take part in that because they think it could affect their treatment if they don't. So we also need to be careful planning mixed methods work with that in mind. And then, like Donna shared in the chat as well, a kind of lack of engagement and lack of awareness of leadership in terms of the potential benefits of including qualitative work. But on the plus side, in terms of what can help, I think making a start on mixed methods in an environment where you've never included any type of qualitative work but might find it useful is really helpful. So identifying areas in your work where that could be really beneficial. So like we've been reflecting on today, and like you've been reflecting in those questions, perhaps a few Pathfinder projects that you can do on a small scale, but see that kind of immediate benefit of including mixed methods and demonstrating the power of it. I think also socializing it and starting to describe what you do as mixed methods, because I think quite often what purely people who conceive themselves as purely quantitative analysts do qualitative work, in that you have discussions before you start analysis, you have informal interviews with stakeholders when you're scoping projects. So actually describing it as that, contextualizing your work, and what you could do in that initial scoping phase that you may already do regularly, apply a method to it. Make it very clear that you're analyzing those conversations at a high level and include it in the process of your research to demonstrate that it's mixed methods. And with that, I think adding that kind of value of mixed methods means that you can start to scope projects from the very start to include mixed methods. It's difficult to tag on at the end, both for kind of time and pressure considerations, as well as in terms of methodology. So scoping it from the very start where you can, where a few kind of qualitative data collection points would be helpful. In terms of networking with others, particularly for those kind of IG ethical queries, which can be very thorny. As a kind of mixed methods research community, we've probably come across a problem before. And as a community, we're really open about sharing what's worked. So I think get in touch with teams such as ours, teams across the health innovation networks, or there may be teams more local to you in your local universities, for example, who do this type of work regularly. And when I say networking with others, I also mean our patients and wider public where appropriate. So we pride ourselves in doing this a lot at UCLP, and including patients and the public in developing our mixed methods evaluation, which has undoubtedly de-risked them and improved the results. And I'd be keen to state as well that it's important to be aware it's not appropriate for all projects. So considering where it works and where it would just be tokenistic. And like I said, a kind of common pitfall in this work is mixing methods superficially, just adding a little bit of qualitative on top of quantitative work, but not integrating it. And also mixing the quality of method. So having really wonderful, detailed quantitative work and a little bit of qualitative on the side, say a few survey results. You need to consider how you're going to balance both qualitative and quantitative in your work, so you can aim for that kind of really purposeful approach. And to mention as well, in terms of developing that skills and awareness, great to hear about future lunches and learns where I think there's going to be more detail about qualitative work and how you can apply this in practice. So for all of us reflecting on this today, take a second and think about, if you're thinking about using mixed methods in your work, what are your next steps? And be great to hear about it in the chat or pop a hand up. Sam, go ahead.
Yeah, I'm going to go again because I did drop into the chat earlier. So our portfolio is supposed to be coming to an end March 27, and we use obviously the story of change. So we collate qualitative and quantitative data for our projects and programs and work streams. Doing a mixed methods evaluation on it would be the next steps. But what I want to know is, would this align to contribution analysis, if you know about that as well? I'm early in the stages of learning about contribution analysis. But obviously we work on projects that impact the wider system. So we couldn't say the impact or any changes are solely from, say, a specific project, because it's part of a bigger picture. So I'm trying to see how these two things would align, the mixed method evaluation and contribution analysis, and if they would work together, I suppose. Because that's what we're considering at the moment, or would look to consider at the moment going forward, to try and evaluate the programme. Does that make sense?
That's really interesting. I'm afraid I haven't used contribution analysis myself in the past. It might be something that Kate on the call has had exposure to. If you could tell us more about it, that would be really interesting.
Well, I've only been to one session about it, and it kind of blew my mind last week. But it was basically just talking about, like I said, so for us, we've got a project that is part of a wider system, and there might be some system transformation. Our project might impact or contribute to that, but we can't say it is the sole reason for that positive change. So contribution analysis would look at how it has specifically contributed to the wider system level change, and how you evidence that impact as well. But again, like I said, I'm at the early stages, and I'm just thinking about the qualitative and quantitative data we collect and how that mixed method evaluation could help reinforce. They could, I don't know, I suppose that's given us the data and evidence from the qualitative and quantitative data that we collect as evaluation, and then we can maybe use contribution analysis to say, okay, we've got all this data and evidence, and this is the contribution it possibly had towards this positive change, I suppose.
Yeah, I think that's really interesting. And interesting that it sounds like you think that there might be a tension between those things, because that sounds like it would be helpful in the contribution analysis, that mixed methods. And I think even if in developing that contribution analysis plan, you find that the methods that you've already been using don't lend themselves to it, I think that's unlikely. But if that were the case, then you could even say with the mixed methods analysis that we don't know enough about how it's contributing, and there are so many other strands that are affecting or potentially affecting this outcome we want to look at. And that's why we're using the contribution analysis. But I think often in these situations, it is those qualitative insights that lead us to determining where those exact steps are.
Yeah. No, thank you.
No, of course. And yeah, I think that's fascinating. And it's something that we often grapple with in our work as well, is when we make a single change in a wide system that is also having all of these other single changes happening at the same time, where is ours directly making an impact? So yeah, thank you for that. And thanks so much, Emeka. Nice to see you. Talking about, in terms of a next step, having an open conversation with team on pros and cons of mixed methods. I think that's really important, because often a lack of understanding leads to this a lack of mixed methods being implemented. And the knowing, Laura, as well, the key principles of mixed methods analysis and contribution are well aligned. Yeah, that's really helpful. And hopefully as well, Samantha, there'll be some consistency between what you're doing as well, to make sure that you don't need to duplicate any results or any methods in either of them. So thank you so much for today. Thank you for engaging with it. If you have any questions about mixed methods, please do get in touch. I've included some resources here related to what I shared today, but please do get in touch, and ultimately, cheers to mixed methods.
Awesome for that. Thank you, Sarah. Anyone else have any last minute questions? Yes, go ahead. Can't see whose hand up. It's on another screen. Amika?
Hello, Sarah. Good to see you.
Lovely to see you
Um,
too.
yeah. I was wondering, are there other methods, or qualitative methods you've used in your mixed methods? For instance, I've encountered several respondents in a semi-structured interview who can give you a response based on how they feel in that situation. But I was also thinking, have there been situations where you use ethnographic studies, look at how people are going through a pathway in a care setting?
Thanks, Emeka. And yeah, I think that's really interesting. There are lots of different qualitative approaches that we might take from kind of opportunistic reasons, in that it's easy to get patients in a focus group, for example, who are going through a certain intervention. We might do individual interviews. We might do survey analysis with ethnographic research. I think it's really interesting and worth reflecting on if it will directly answer the question that you want answered, but also if practically you're able to do it. The ethnography work that I've seen before, definitely in terms of understanding how people move a pathway, is really helpful. There are lots of kind of ethical and practical considerations to how you do it. But we've used it in a few circumstances, like watching people as they receive a new innovation in a GP practice. And like you said, or like I think you said, sometimes people can be biased in their semi-structured interview responses. But some of that bias can be removed when watching people in practice in the moment, seeing what's happening. So, for example, somebody might say, after being offered a new treatment, they would say, yeah, no, I'm definitely planning to do that. That's definitely something that I would like to do in future. It's like being offered a new exercise program. But in practice, in the moment, from attending appointments, for example, you'd be able to ask them in practice or see in practice that people coming back for follow-up appointments are saying, no, I didn't get round to that. There were lots of reasons why I wasn't able to get round to doing this exercise program that you recommended. So I think having that balance is really helpful, and it's whatever is useful to your research, whatever works in a methodological sense, and whatever is practical for you to do. But really recommend watching previous Lunch and Learns, which go a lot into that kind of qualitative research, and I see a few more are coming up in the future as well.
Any other questions? All right. Well, then we will end it there and give people a few minutes back. So thank you for coming. And Sarah, thank you very much for joining us and offering your presentation. We will, if you could send the slides to Lizzie, we'll get everything onto the website so people can watch it back if they weren't able to attend. So thank you very much. And we will hopefully see all of you at the next session. Have a wonderful rest of your day.
Great.
Thank